Mr. Speaker, ladies and gentlemen of the House, while I agree with some of what's been said on the House floor today, I don't agree with everything that's been said. We are starting a foundation for children's mental health in the state of Iowa for every child across the state to be able to access equal services. We are looking at how we can make sure that we are engaging school personnel and training them and getting them the education that they might need to be able to see the need for early intervention and early signs. This bill has been worked on bipartisanly. Representative Brown Powers and I worked very closely on this bill throughout the course of the time. But before that, this bill had numerous individuals feeding information and creating reports to help create what this bill has become today. And let me tell you, that wasn't one side of the aisle sitting around the table. It was a bipartisan effort of providers, of parents, of educators, of legislators. So to suggest that this has been one party or to suggest 3 or 4 people have done this bill is absolutely false. Representative Smith, I would have been happy to sit down with you at any point had you asked to discuss any of the questions you had, but you didn't come forth, you didn't ask the questions. I invite that moving forward. The second thing I would like to bring forth is the notion of payer source and how this bill will be funded. Correct, we don't have those pieces all worked out yet, but what I can tell you in core services that this bill outlines is that 56%, Representative Anderson, is private insurance reimbursed of core services today. So private insurance does have skin in the game, and they are at the table, and they will be reimbursing and will continue to reimburse. 41% is reimbursed under Medicaid, and only 3% is uninsured when it comes to the core services outlined in this bill. So do we have all the funding sources nailed down? Absolutely not. But do we have a good understanding and idea of today where the money is at in the system to help provide children's mental health in the state of Iowa? Absolutely. It's been a privilege to be able to lead this discussion this year and to be able to look at how we can model a children's mental health system in the state of Iowa after what we have done with adult mental health. There is work to do in both areas. I will absolutely admit to that, and I would invite anybody that wants to continue to be a part of that process to surely come forth. I want to end by saying this is not the only thing that we have done this year or that we will do this year as it relates to children. We have also expanded in today's legislation the crisis-wide hotline for children's mental health services. We've provided additional funding for developing mental health professionals in rural Iowa. We have eliminated the waiting list for children's mental health home and community-based services waivers. Folks, we are taking this serious, and it's a comprehensive approach from many different angles. So I believe we can go back home today to our forums over this next weekend, and we can say we have passed a robust children's mental health piece of legislation that lays the groundwork for what will come in the state of Iowa. I also want to be clear and say again, providers, parents, those of you who have children who have these needs, we have systems in place today. We have providers who are providing excellent care today. There is no reason a child's needs should go unmet in our state today because of the providers we have are doing excellent work. I look forward as we move forward to look further at how we will enhance this, how we will continue to roll this out, how we will continue to fund this. And today I stand proud of the state of Iowa and the work that this legislative body has done for children's mental health. With that, Mr. Speaker, I move House File 690 as amended.
The gentleman from Clark moves the bill be read for the last time and placed on its passage. Are there